Hi and welcome to Genetics Decoded. I'm Sharon Palmer, your host. Please note that the information that we're presenting here is not to be taken as medical advice. It really is for general information only. If you enjoy the podcast, please remember to like and subscribe. It won't cost you anything, but it certainly helps to support what we're doing here. Today, we're going to go in and look at your gut bugs, your gut microbiome. It's a little bit of a buzzword in the industry right now. People are talking about how important the gut microbiome is. We're even hearing things about fecal transplants. People are taking their probiotics, they're trying to change their diet, all for the purpose of improving this gut microbiome. But the thing that you really need to understand first and foremost, the most important thing around your gut microbiome is something called your secretor status. Your genetics will determine whether you are what we call a strong, a mild, or a non-secretor. This is going to change everything around the gut microbiome, what types of bacteria can live there, how do you feed them, how do you look after them, what is the impact on our health. So stay with me today as we really dig down into the importance of knowing your secretor status and how to better support your gut microbiome. Today we're going to be looking at your gut bugs, better known as the gut microbiome. And it's a bit of a buzzword these days. We've gone from thinking that the gut bugs don't do anything, particularly from a medical point of view, with all the recent research understanding just how profound their effect is through the body. But I want you to think about your gut microbiome. We're talking about the bacteria that are living in your large intestines. How do they live in there? Like, are they just floating around in your intestinal tract? Are they attaching to your intestinal wall? Like, how do they do that? These are very important questions to ask, and they're things that we often don't think about. We just think, oh, our gut microbiome. But we really need to understand how those bacteria are living in our gut, how they're attaching, and to know that our genetics is playing a role in all of that. People are trying to be very proactive today around supporting their gut microbiome. They're taking their probiotics. Not that I agree with the mechanism or the pathway that a lot of people are doing that, but a lot of people are using probiotics with the belief that it's going to support or enhance their gut microbiome. They're eating their fermented foods and making their kimchi and thinking that they're putting these important probiotics back into the gut. They are changing their diet, understanding the need for resistant starch. All of these things are to get our gut microbiome better supported and therefore support our health. But the most important thing you need to know around your gut microbiome is something called your secretor status. And it's probably something almost none of you have ever heard about before. Everyone listening to this podcast will be a strong secretor, a mild secretor, or a non-secretor. Your genetics is going to determine which one of those you are, and that's going to have a profound impact on your gut microbiome. It is going to impact on the species that can live in your gut. It is going to impact on the way that your gut microbiome can adhere and colonize to the intestinal wall. It is going to play a role in how your gut bacteria work. It's not just the fact that they're in your gut that is beneficial, it is all of these metabolic byproducts, and your secretor status is going to change those metabolic pathways in your gut microbiome. It's going to change, do you need a probiotic? What type of probiotic do you need? So all of the things that we're doing around our gut, all the things that are really important, it comes back to understanding your secretor status. So today we're going to have a really good look at what is this secretor status, how is it going to impact, and why it is so important for you to find this out. So before you swallow another probiotic, eat your pickled cabbage, you want to know what your secretor status, because I hate to tell you that if you get it wrong, all the things that you'll think you're doing that have been beneficial may not be doing any good at all. What is your secretor status? The only way you're going to know that is through doing your genetic screening. I put screening your secretor status in the top 5 things that I want to know at a clinic level. And the reason for that being is that we really do understand now that the gut microbiome is playing such a big role in our health, not just around our gut health, but across every aspect of our health. It is of benefit to have a nice, robust and diverse gut microbiome. But even if you think you're doing all the right things, it may not be what you want it to be. You may be what we call a non-secretor, and if you are, then there will be very, very specific things that you need to do. So let's really go in and examine what it means to be a secretor, either a strong or a mild or a non-secretor. If we go back and look at the gut microbiome, and it comes back to that question that I was asking you just a little while ago, is how do your bacteria exist in there? You know, a lot of people it's never even occurred to them like, well, I don't know, they're just in there. But they're not just floating around in there doing their little breaststroke or, you know, trying to make sure they're not pushed down into the colon and excreted out through the body. It is really important for your gut bacteria to adhere, to attach to the intestinal lining. And you produce a very particular protein in order to make that attachment protein. And your genetics is playing complete control as to whether you make a lot of that attachment protein, that's what it means to be a strong secretor, or you're making that protein but at reduced levels, that's a mild secretor, or you're a non-secretor. You have no capacity to produce that attachment protein at all. And that should make you think, wow, if my bacteria have to adhere to my intestinal wall in order to colonize my gut, and I don't have that attachment protein, like, how do I get that bacteria to live in there? And that's a really good question to ask, because with non-secretors, it is not easy to fix that. And if you think you're just going to take a bunch of probiotics and it's all going to sort itself out, it's not going to happen. There's this particular process in the body. It's called fucosylation. I know it's a big word. And there is a particular enzyme in your body that performs this function. And what it does is this fucosylation produces this kind of lovely, it almost looks like a little candelabra, and it sticks up out of your intestinal lining, and your bacteria, your gut microbiome, is going to attach to that attachment site. Now, strong secretors make really good amounts of that attachment site. Mild secretors are producing it, but at reduced levels, and there's none of that for non-secretors. Non-secretors do not produce that enzyme and therefore cannot make that attachment protein. And you really need to know, especially if you're a non-secretor. Non-secretors have some real challenges from a health point of view. As you could well imagine, if you're not able to colonize a lot of your microbes, then it's going to have a very negative impact around your health. But it opens up the door to a lot of issues around immune dysregulation and autoimmune disease, as well as the obvious issues around, the gut is not just very healthy. The people that I see in clinic who have just had these long-term issues with their gut, they come in and they go, I've been experiencing this problem for the last 15, 20, 30 years. I've seen everyone. I've tried everything. Nothing is helping. I don't know what to do anymore. Often a lot of those people are non-secretors. And if you are a non-secretor, your interventions really need to be very specific. Otherwise, you're not going to go much further. Your secretor status is determining whether you can make this attachment site. And we know that strong secretors have the most robust and diverse gut microbiome. It's a real plus from a health point of view. It doesn't mean that they can't mess that up. If you have a terrible diet or you take a lot of antibiotics, it could still really negatively impact. But, a strong secretor, even if they kind of mess up their gut microbiome, take a lot of antibiotics, they have a much better capacity to rehabilitate their gut as well. Whereas with a non-secretor, after antibiotic use, where not just the bad bugs, but a lot of the good bugs have been destroyed, they have enormous challenges in recovering and supporting their gut microbiome. And it's a little bit ironic in a way because non-secretors are much more prone to a lot of infections and a lot of problems. They're often more at risk of being prescribed antibiotics, which then makes the underlying condition worse. And then they kind of get on this roller coaster of, antibiotic after antibiotic. If you're a non-secretor, you're very vulnerable, but sometimes a lot of the interventions that are being put your way could be making the underlying problem even worse. If we look historically from an evolutionary point of view, the normal presentation here is to be a secretor, particularly to be a strong secretor. And you look and you go, well, if it's such an advantage to be a strong secretor, why would it have some people become a non-secretor? Like, isn't evolution meant to be of advantage to us, not putting us at risk? But what we have to do is put aside what's happening to our gut microbiome, and we have to really understand the role of this attachment protein. It is not just your good bacteria that use that attachment site. It is also pathogens that will use that attachment site. If we look, before we had antibiotics, getting infections killed us. A lot of people died of simple infections or infections that we would simply take an antibiotic for today and we wouldn't even think twice about it. And your body, like as a species, we had to learn to exist within our environment. We had to be able to live in it and not be killed by the things that are in it. So we started to see that the attachment side and the pathogens in our environment were kind of interacting. But as a species, we love to roam. We love to go new places. But of course, when we're sitting here with our genetics, we've learnt to interact and create this balance with our environment. But then we look and we go, I think it'll be good to go and live over there. But what you do is you take your genetics with you. So you go to this brand new environment. Now, you get to that new environment and the pathogens in that environment may be completely different. You might come across a pathogen there that loves this attachment site. So now it has this ready access to colonize your gut and really cause problems for you. Now, for the people that were mild secretors, they might have got infected with that pathogen. They might have got quite sick, but they didn't die. Therefore, that non-secretor gene, a mild secretor has a secretor gene and they have a non-secretor allele. And it would have been beneficial to pass that on. And so we started to see people who would end up with the non-secretor status. It was really beneficial to not have that attachment site because of certain pathogens. And in fact, when we kind of trace the evolutionary pathway, we can kind of see how that secretor status changed, and we can also see the type of pathogens that are in the environment. And this is why when you see people get exposed to bacteria and viruses, not everyone has the same outcome. Some people can get really, really sick, and some people even die. Other people go, I don't know, I don't even think I had the infection. And if we look at COVID, that we've just all recently gone through, you saw the same thing. Some people got really sick and died, and other people me included, I don't think I've ever been infected with COVID, or certainly not that I know of. Just because we're exposed to a pathogen does not mean it's going to act the same way in our body. And this secretor status is really changing our risk of certain pathogens and our ability to protect ourselves. When we look at secretors, we know that they have an increased risk of certain pathogens and they have a decreased risk of others. And it's almost the complete opposite for non-secretors. We often hear of a pathogen called Helicobacter pylori. So it can cause a lot of upper digestive issues. We know Helicobacter pylori is what's behind ulcers and also behind risk of stomach cancer. People who are strong secretors are incredibly vulnerable to Helicobacter pylori infections. And that's because Helicobacter love that attachment site. They need to dock onto that attachment site in order to replicate. So if you're a non-secretor and you don't have it, it is very, very difficult to be infected with Helicobacter. And we see this over and over again. And that was the evolutionary development of non-secretors. Your body wasn't thinking, oh, what's this going to do to my gut microbiome? The first thing you want to do is survive. But we now know from the research that this secretor status is really impacting on the ability of our bacteria to colonize. And if we look again from the minute we're born, we know that people who are non-secretors, from the minute they're born, this is negatively impacting around their health. One of the first species that should colonize your gut is bifidobacteria. And again, bifido really require that attachment site. For infants who are non-secretors, they may never ever colonize bifido. We're seeing from the research that there may be certain species of bifido that have never colonized the gut, or if they are there, they're barely hanging on. And then, of course, bifido would eat certain foods and it would produce all of these metabolic byproducts that would then kind of attract other bacteria. And we know from the research that the gut is colonized in a pretty systematic way. If you look at bifidobacteria, it is a very common species in a lot of probiotics. And if you're a non-secretor, how is that going to work for you? And this is where just taking probiotics may not be doing anything for you. If I have to treat a non-secretor, I will always give them bifido, and it won't matter what their age is. We'll be focusing on, what we would term babybiotics, because probiotics for children are predominantly bifidobacteria. That's the main species that should be there. I will start all of my non-secretors on a very high dosing bifidobacteria that is designed really for infants and young children. But if I just do that, it's not going to work. And the reason for that being is this attachment site is not just an attachment site. On the very tip of the attachment site, so sitting right on the end here, is this compound called fucose. And fucose is a really critical food supply for a lot of species, including bifido. So I always say to my non-secretors, these bacteria come into your intestines, you give them nowhere to live, you don't feed them, and all they want to do is go and find a secretor because you're so hostile to them. And so we've got to create an environment in which it becomes easier to kind of colonize and get these species in. So if you're a non-secretor, besides just taking your bifido, you need to be introducing this fucose. Now, at the clinic, we will use very particular supplements that will contain fucose, but we also know that fucose is found in certain foods. This is where, for non-secretors, we would start to really change the type of probiotic we recommend, but we quite significantly begin to change their diet. And we know that fucose is found in pretty good concentrations in certain forms of seaweed and certain forms of mushroom. Not all seaweed and not all mushroom, but we know that the brown seaweed, the kelp and the wakame is really high in fucose. And we know that things like shiitake mushrooms and porcinis and chanterelles are high in fucose. So this is where we start to really shift dietary intake. How do we try and get some of those foods in every day? But if I've got somebody who is a secretor, I'm not really pushing their diet through those pathways. So this is, again, what works for you from a dietary point of view to support your gut microbiome will be really different for someone else. We've got to start moving into this realm of personalised healthcare. But if you don't know your secretor status, you've got no idea how to make those personalised decisions. The other really important influence of secretor status is directly on the gut microbiome itself. So we know that we want a nice, diverse gut microbiome, lots of different species living in there. But your gut bacteria, they're not created equal. Some are much more important to have within the intestines than others. And we refer to these as your keystone species. Now, if we look at secretors, we know that they have a much better and robust gut microbiome, but it doesn't mean that everything is doing well in their gut. And we see that they can often have a real problem around supporting something called Faecalibacterium prausnitzii. It's a keystone species. If it's not in the gut, there can be some real impact around health and risk of disease, particularly risk of things like inflammatory bowel disease, ulcerative colitis, Crohn's disease. And the thing is, we have kind of got into the mindset that if we just take some probiotics, we'll just introduce these species in and everything will be fine. Our access to probiotics, the different species that we have access to, is very, very small compared to all the different species that are in the gut. So we've got to let go that just taking probiotics is going to be the solution here. But with this keystone species that I just mentioned, the Faecalibacterium prausnitzii, it doesn't come as a probiotic. So when you look at your gut species, they're going to fall into two categories. They're going to be either aerobic, in which they need oxygen to survive, or they're going to be anaerobic, and they exist without oxygen. And in fact, if you put them into an oxygen environment, it tends to kill them. This keystone species, Faecalibacterium, is an anaerobe, and that's why you don't find it in a probiotic. Trying to manufacture that in an environment that has got oxygen and to keep oxygen away is pretty much impossible at this point. If you're a secretor and this keystone species is at risk, you taking probiotics is not going to do anything here for you. The only way that you can look after this keystone species is through your dietary choices, but it's not going to be the mushrooms and the seaweeds that we're focusing on from the non-secretors. It's going to be key food groups around things like your fructooligosaccharides and your inulin and your what we call your GOS, your galacto-oligosaccharides, and your resistant starches. We will start to direct people to getting some of these key food groups into their diet. And this is where I also caution people when they're removing key food groups from their diet, particularly things like gluten and dairy. Now, at a clinic level, I direct a lot of people to remove gluten and dairy because I go in, I look at their genetics and I realise that they're gluten intolerant or they have a cow's milk allergy, so it needs to go. But because I understand secretor status and I understand this keystone species does particularly well on foods that are high in gluten and dairy. So if you're a secretor needing to remove gluten and dairy, this keystone species that is already at risk now becomes even more challenged. Now you're starting to strip some of the foods that it really likes. And this is why we've got to be so careful where we have these broad statements like everyone should remove gluten from their diet. They will do so much better. That is not true, especially if it's putting your keystone species at risk. We need to have much better information by which to make these decisions. And also know that as we make them, there may be some real benefits in one area, but there may be some risk factors that we have to address. But if you don't even know about those risk factors, you're doing all of these things over here without even realizing that you just may be just creating problems in different ways. For people who are strong secretors, we're really changing their diet, but in a completely different way. And the focus isn't on just giving them probiotics, it really is on diet. So again, by knowing your secretor status, you can really make very significant changes around your diet to support that secretor status. The other thing around your gut microbiome is when we talk about it colonizing your gut, and even when we've got this attachment site, your gut bacteria it's not a good thing for them to have direct contact with your intestinal lining. Your immune system kind of freaks out about that. There needs to be this lovely little sterile layer. It's this sterile mucosal layer. And it sits across your intestinal lining, and it really helps to protect your intestinal lining. And what we know is the colonization of your bacteria should be in the top third of that mucosal layer. You don't want it to get any deeper or closer, because once that happens, your own immune system just begins to react, and you can get a stronger inflammatory, immune and autoimmune risk. Now, the problem with non-secretors is this mucosal layer is either very, very thin or kind of not there at all. And so this puts non-secretors at risk, because when there is colonization, it is in direct contact with the mucosal lining, and the body just doesn't like it. And this is, again, one of the reasons that non-secretors have a lot more gut issues, a lot more inflammation, there's a lot more immune response, there's a lot more autoimmune triggering. And you look and you go, well, what can we try and do about supporting this mucosal layer? And again, if you're a strong secretor, we don't need to have those challenges, because you should have this nice thick layer of mucus that in the bottom 2/3 is sterile. And it's very interesting when you look at the research and we look at people who develop Crohn's disease and ulcerative colitis. What we're really finding is that we're seeing with these diseases either a shortening, so the mucosal layer just gets a whole lot shorter, or you're beginning to see an infiltration of that mucosal layer by that intestinal bacteria. Good or bad, it doesn't matter. You don't want it in direct contact. These are all the things that you need to start to think about when you understand people's secretor status. Some people, you've got to do really key things to support it. Other people, you don't even need to put it on the list for things of consideration. What I know is that because I've seen so many patients with so many gut issues, one of the programs we have at the clinic is something called a gut and immune rebalancing program. More people register for that program than any other program that we offer, and that's because so many people are struggling with gut issues. People are confused around their food intolerances, and you want to know what your food intolerances and allergies are, because once they're in the intestinal region, they're going to be triggering that inflammatory response. And if you're a non-secretor, your inflammatory response is going to be much more aggressive. It's going to run the risk of not being able to be settled down and become chronic over time as well. Your non-secretor status can really impact your health in a lot of negative ways. As we've gone through and looked at some of the risks and some of the impact of secretor status, most of you are probably going, I don't want to be a non-secretor. And you would be right, is you really don't want to be a non-secretor. Only about 20% of the world's population are non-secretors, but in the people that are, you want to know because now you've got real capacity to go in and make some changes that should improve your outcomes. And that leads to a lot of people saying, oh, I wish I was a secretor. But swings and roundabouts. If you're a strong secretor, you're making a lot of that little attachment site, so it's sticking up out of the intestinal lining and all of your bacteria can adhere to it. The problem is that little attachment site is blocking your B12 from being absorbed across the intestinal wall. So when we see strong secretors, we go, okay, we want to deliver your B12 in a completely different way. If you're not effectively absorbing it across the intestinal wall, we're going to deliver it to you either sublingually, so you'll absorb it across the oral mucosa straight into the blood, or maybe you'll be better doing an intramuscular B12 injection. If you're a non-secretor, and in fact, that's one of the benefits of being a non-secretor, you actually have very good B12 absorption, as long as there's not some other genetics getting in the way of that. So you can see it really is swings and roundabouts. Once we've got someone's secretor status, I can understand their risk of disease. I can focus specifically on certain species. I can change the diet. I can understand where their nutritional risk may be a problem and address that. So at a clinic level, the way that I treat a secretor will be very different to how I treat a non-secretor. It's very interesting that right now, almost nobody knows about secretor status. I have started to get some patients in and I go, why have you come here? And they go, because I want to know my secretor status. And I go, how did you find out about that? So it is starting to filtrate out there. I know there's a lot of practitioners who are working around the gut microbiome who have never heard of secretor status. It's going to be one of those things that we go, oh, okay, once we know, we will want to go in and have a look. We are also seeing there's a really strong selection of companies out there who are offering gut microbiome analysis, where you go in and you measure and you assess the type of bacteria that are part of that gut microbiome. And they can be very, very useful tools, but at a clinic level, I still really want to know what their secretor status is. If I do one of those gut analysis tests and let's say the bifidobacterium comes back low, if my patient is a non-secretor, I go, oh, well, who's surprised? I would expect it to be low. But if that bifido is low in a secretor, I would be kind of surprised because it should be reasonably robust in secretors. But my intervention for low bifido in a secretor will be different to my intervention for low bifido in a non-secretor. So again, just because a species is low doesn't mean that the intervention is going to be the same. So it doesn't really matter what you're doing around your gut microbiome. You really want to go in and get this foundational knowledge around what is my secretor status, and then start to make those decisions on top of that knowledge base. Today we had a really good look at the gut microbiome and around something called secretor status. It is really important before you kind of swallow your next probiotic, take your next lot of fermented food, to find out what that secretor status is. The only way that you're going to be able to do that is through genetic screening. I do know that there's not a lot of companies that are really on top of secretor status. They tend to be looking at the gene that's playing a role here. They tend to focus only on its B12 absorption issues. If this is something that you want to know, please get in contact with us through our clinic. It's called iDNA Health. We have a number of clinics here in Western Australia, but we treat patients all over the world. We're completely equipped to do online consults. We can post our kit anywhere in the world. And if you're living overseas and you've done things like your 23andMe or your Ancestry, we can upload your raw data directly into our system, and you don't even need to start with getting another DNA test done. So if you're really interested in finding out what your secretor status is, we would be more than happy to help you. Just get in contact with us through iDNA Health. Thanks for listening to the podcast today. If we've started to increase your interest around clinical genetics and you think you would like to find out a little bit more, please feel welcome to reach out to us at iDNA Health Clinic. We're proud partners of this Genetics Decoded podcast. It's a real opportunity to get in touch with us and find out how you could go down this pathway yourself. If you liked the podcast, enjoyed it today, please go in and push all the buttons, like and subscribe. It really does make a difference and supports what we're trying to do here. We have a podcast release every Monday, so keep a watch out. All of our topics are around genetics and health, and we would love you to join us every week.